Hello and welcome to all our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold Learning. And here at Gold, we are preparing for our Gold Lactation online conference of 2021, the 15th year we're doing this amazing conference. And here with me today is one of our speakers, Annette Leary.
Hello, everyone.
Hi, Annette. It's so good to have you back.
Oh, I'm so honored and I'm really happy to do this. I've missed conferences all year long and meeting with my friends from all over the world, my breast friends from all over the world. I
Your
miss them
breast.
dearly.
Oh, wonderful. So you during this conference, you will be able to catch up with some of them again here.
Hopefully I can, yes.
Perfect. Wonderful. Yeah. So tell us a little bit about what have you been up to? I know you have been in lactation for such a long time now. So give us a little bit of a background and what you're working on now.
Oh, working on so many things. I'm really blessed to work with so many wonderful families out there. It seemed like when our world changed over a year ago, things got really quiet out there for everyone. Well, I work at a very large institution, a very large hospital, and we had to quickly shift gears because no one was calling the hospital. Nobody was looking for help at that time. Everyone was kind of in a quiet mode the month of March. And
Yeah.
we quickly switched to doing everything virtually, live virtual classes, live virtual visits, and so forth. And my own private practice, when everyone was isolating, I had to switch to a new format as well to connect with the families.
And have you been doing virtual work before, or was that completely new to you?
It was completely new to me. Yeah, for the most part. I
Uh,
mean, when I say new to me, I have met with families
Yeah.
through FaceTime, through
Mhm.
WhatsApp. When I've worked with them, maybe they came from another area of the world to deliver at our hospital. We connect, and I say, when you go back home, don't worry. Here's my WhatsApp number. Here's you can FaceTime. So unofficially, I would meet with them, or if I had family and friends from all over the world that said, "Oh, please, can you help my sister in Italy? She really is
Yeah.
having a difficult time getting help with breastfeeding." So it was not it was just using the proper format and the secure format. It was more unofficial before. Sure, I don't mind meeting with her and talking with her. Yeah.
Right. Yeah, but
Yeah.
it's different. Yeah. So, but you also integrate body work into your treatments. You're a cranial sacral
I'm
practitioner.
yes, I'm trained, upledger trained in craniosacral technique.
Wonderful,
Yes.
and that's so beneficial, right? But how does it work? Can you probably come to this virtually? How do you work around this, or are you
Well,
still seeing clients?
I am still seeing clients. Yes, I'm here in Orlando, Florida, so it's a little bit different. I wear masks
Uh-huh.
when I treat and work with the families, and the families wear the masks in the room. But I can do some things virtually, showing
Good.
parents where to place their hands on the baby. Even when it came to assessing how the baby was sucking, I would ask the mom how to place their hand in the finger in the baby's mouth. What did they feel? Can you feel this? Can you feel that? Feel the tissue in the cheeks and in the lips. And it was really pretty useful because then when I sent them back to their providers, I would say, please let the baby's doctor know that this is what you're experiencing and this is what you're feeling. But when it came to body work and craniosacral, the families often say to me, when you hold the babies, it's like magic. They just melt and they get
Uh-huh.
really quiet. I said, it's just staying calm. I don't really have any agenda. And you can do the same. Just sit there and hold your baby in this way, or showing them different ways that they can do tummy time and movements with their baby.
It is, yeah, as you mentioned, it's probably not the same as, when you are doing the cranial
Right.
sacral therapy.
Yeah.
However, it is also nice to kind of give that, a little bit of knowledge to the parents and teach them how to do it because that's something they can take with them as well. And I know you probably do that in your
Absolutely.
practice on a one-on-one practice as well, where you show, you're doing something and also show the parents how to do that, of course, too. But even in virtual, it must be good for the parents to know, okay, I can learn this, I can also use some of the techniques myself.
Well,
Um,
parents just want help their babies. They just
Yeah.
want their babies to feel better. And
Yes.
many times when we have, I have an outpatient office at the hospital as well, where I see, no, for a while we didn't, but now they're coming in, and we're doing in-office visits. Whenever I train new staff, first thing I have to say is, please put your hands in your pocket, because your hands aren't going home with that family. You can show the parent where to place their hand on their baby, where to place their hand on their chest,
Yeah.
so that but they have to learn how to do this. And that's all that they want. So like I said, through virtual visits, there are challenges to that. And we're going to
Yeah.
have a panel on that and talking about that during this conference as well. But one of the challenges was teaching them it's okay to put your fingers and wash your hands, put your fingers in the baby's mouth, do this, do that. And it made them feel better, that they feel like they can also do something. And even when we're here together,
Yes.
it's a whole family approach. I asked one of the parents, place your hands here and here. I'm going to work at the top part of the baby. You can be on the bottom part. And what do you feel? Do you feel that change? And what do you see? Do you see those changes?
Absolutely. And that's very helpful too. And I'm sure the parents appreciate that
They
as well.
do.
And yeah, absolutely. So let's talk about this presentation that you have here with us at the conference. It's an interactive case review, prioritization, and I stumble over the word again, prioritization of care. Why don't you say it?
Yeah. Prioritization of
Of
care.
care. That's
Yes,
it.
this comes up quite a bit. Sometimes we start our day and we can almost feel overwhelmed, whether you
Yeah.
work within a hospital setting or your phone. You wake up and there's several messages via email, via text, via phone calls, and you're thinking, where do I start my day? Who do I? How do I split myself in many different um, spaces, and what is the how do I do that? And also part of that is, how do I keep that with a mindfulness and a work life balance? Because I think many of us can struggle with that. There's only one of you,
Yeah.
and learning what your resources are in your community. That's one of the things we're going to talk about. We're going to come up with a collaborative list of resources, whether it's other lactation consultants or lactation support people in your community, whether it's your ancillary, I'm not even using that word correctly, probably, whether it's like using an OT or speech therapist or a physical therapist. Who else does this baby need to see? And advocating for that baby to go back to the practitioner, even though they said, oh, don't worry about it, come back in 2 weeks. Oh, don't worry about it, come back in four
Right.
weeks. We're
Yeah.
teaching, one of my favorite things to do with a parent is teaching them how to advocate for them and their baby.
Advocate for them and their baby. And what I love about this is it's a completely interactive workshop where
Yes.
you have some really case studies in there, and you have our delegates really do some work here, but in a great way. They feel like they can be part of this and deciding and coming up with answers and prioritizing there as well. So it's
And
gonna
these
be
are live cases. These are
yeah,
real cases that and families that I have worked with over the 30 plus years of being a consultant. So that's the fun
absolutely
part of it, and
fun part.
and giving the feedback. And for me, it'll be great to see and interesting to see the response that the delegates have and what they choose
Absolutely.
as interventions. Because you're going to be able to choose, what would I do for this
And
situation? What should I do first? What are there
first, yeah.
two things I would do? Yes, so that's
Yeah,
gonna be a lot of fun.
lots of fun, lots of interactions, and there is some homework assignments too. But for our delegates, don't worry if you don't get to it. You have
That's
a
right.
chance during the entire conference to go view it. But that's also on the website. There's assignments, there's the interactive case studies, and sharing this resource list or putting together this resource list. So this is definitely a presentation that's not to be missed here.
I agree. We're gonna have a lot of fun. We're gonna learn from each other all over the world,
Yeah.
because things can be maybe looked at differently in different sides of our country, so in our world.
Absolutely, absolutely. Annette, before I let you go, and this is such an exciting presentation that we're looking forward to here. But before I let you go, what little nugget of advice do you give our viewers?
Oh, give our viewers, you know, never for me, I always learn every single day something from the families I work with, and um, you know, being able to share our experiences with each other is so important. And that's what this presentation is going to do. We're going to share our knowledge because all of you out there
Yeah.
already know that you're doing a great job, but this is going to help you feel a lot better when we're all collaborating together and going, yes, we all thought that that was important, or we all wanted to do
Yeah.
that. So, negative advice, just keep doing what you're doing. You're doing a great job. It hasn't been easy this year. There's been a big learning curve for all of us in learning how to reach our families and help all the families and keep them from slipping through the cracks. And yeah, that's what I would offer.
Beautiful. Well, thank you so much, Annette Leary, for sitting down here with me chatting, and we're looking forward to your presentation.
I'm looking forward to being with everyone as well. Thank you so much for this beautiful opportunity.
And now for our viewers, if you have any comments, you can post them below, of course. And if you would like to find out more about this fantastic interactive case study, and also case study review rather, and also about all the other presentations in the conference, we invite you to go to goldlactation.com. And this presentation here will be live on April 26th. I hope to see all of you at the conference. Bye bye, everyone.